Aortic dissection in animals. It does not affect your heart and circulation. It occurs when an aorta becomes enlarged, separate, or moves.
The aorta is the largest artery in your body. Your heart pumps fresh oxygenated blood through your aorta to deliver oxygen and nutrients to all your organs and tissues. Your aorta is divided into two main sections, the thoracic aorta and the abdominal aorta. The thoracic aorta has four parts: the aortic root, ascending aorta, aortic arch, and descending aorta. The wall of your aorta is composed of three layers that give it strength: the intima, or inner layer, the media, or middle layer, and the adventitia, or outer layer. The elastic, muscular media prevents your blood pressure from rupturing the wall. Over time, degenerative disease may cause the media layer to break down, weakening the wall of your aorta. Blood pumping against the weakened area may cause it to bulge outward like a balloon. When this condition occurs in your chest, it is called a thoracic aortic aneurysm. These aneurysms may occur in one of several places, including the aortic root, the ascending aorta, or the descending aorta. Blood pumping against weakened aortic walls can lead to another life-threatening condition called aortic dissection, which may or may not occur within an aneurysm. Most commonly, aortic dissection begins with damage to the intima layer. Blood moves through the break in the intima, separating it from the media, causing bleeding inside the wall of your aorta. As a result, a flap called a septum forms between the true aortic channel and the false channel. From here, the blood may break through the outer layer of the aortic wall, causing an immediate life-threatening condition. Or it may re-enter the aorta through another tear in the intima. Over time, a blood clot may form in the false channel. An aortic dissection may be classified according to its location and duration of symptoms. In the Stanford system, if you have an aortic dissection in your ascending aorta, it is called a type A dissection. All other dissections are called type B. If your symptoms have lasted less than 2 weeks, you have an acute dissection. It can be rapidly fatal and requires immediate medical attention. If your symptoms have persisted for 2 weeks or longer, you have a chronic dissection. Your doctor will monitor it closely for changes. For more information, please contact the Center for Aortic Disease at the NYU Langone Medical Center.
How is it inherent? The disease is a dominant trait that you only need one part to have it to possibly be affected by. No gene is not gender specific. People with an affected parent have a 50-70 chance of inheriting the disease. They may also have heart complications, other heart problems, and or conditions. Signs and symptoms: chest pain, deep aching or throbbing, shortness of breath, coughing, back pain. Other more common problems may have a few similarities. Sometimes people with the disorder may be diagnosed with heart murmurs or palpitations too. If an aneurysm ruptures, there is a significant drop in blood pressure, internal bleeding, severe pain, and if not treated immediately, death occurs. echocardiograms, CAT scan, MRAs, and other tests can be done to diagnose the disease.
The heart is a beating muscle that pumps oxygen and nutrient-rich blood throughout the body. Each beat is stimulated by electrical signals that pass through the heart muscle or myocardium. In order to examine the function of the heart, a doctor may perform a test called an electrocardiogram or ECG, also referred to as an EKG. During this test, electrodes are placed on the chest and recordings are then made of the heart's electrical signals. Sometimes the electrodes are also placed on the arms and legs. The electrical signals follow a set pathway through the heart, beginning at a spot called the SA node, which is located in the top right chamber or atrium. The signal then branches out through both the right and left atria, which contract and push blood into the lower chambers or ventricles. The electrical signal also passes into the ventricles via the AV node and then travels down the tissue that separates these two lower chambers. Finally, the signal travels back up the ventricles, which contract and pump blood to the lungs and body. Variations from the normal electrical pattern may indicate damage to the heart due to a heart attack or heart disease. Often a patient will be required to perform a stress test during an ECG. A stress test usually involves walking or running on a treadmill at progressively increasing intensities while recording an ECG. This test allows the doctor to examine the heart's electrical activity during the stress of exercise.
The treatment: medication that slows the heart rate and reduces blood pressure can be used to treat dissection and aneurysm. In some cases, open heart surgery to repair or replace the aortic valve. After a rupture, it must be treated immediately. However, there are certain ways to reduce and prevent dissections and ruptures.
Aortic aneurysms are called silent killers because there are no symptoms and usually are detected incidentally.
An aneurysm is, in very simplistic terms, a ballooning of the artery. So much like a balloon, if you keep filling air in it, it's going to pop at some point in time. So the same concept applies to an aneurysm. As the size keeps increasing, at some point in time, it will rupture. And as and when that ruptures, that usually means death. So the idea really is to prevent it from rupturing.
On May 18th at 7 p.m. Eastern Time, Pinnacle Health will present an OR Live webcast of a stent graft repair of a thoraco-abdominal aneurysm. Dr. Brajeshwar Mani, co-chair of cardiovascular research at Pinnacle Health, along with Dr. Sung-Jin Park, cardiovascular surgeon, will explain the surgery as it takes place and also answer live email questions from viewers during and after the procedure. Pinnacle Health surgeons are using stent graft procedures to repair and resolve ever more complex aortic aneurysms. Today, instead of cutting open the chest, surgeons can implant these grafts through small incisions in the groin or even percutaneously through the skin. The risk of mortality is significantly reduced, and patients usually go home the next day.
If you're looking at cutting-edge technology, we have availability of that. We have years and years of experience behind our back at this point in time. And then if you complement that with the facility that Pinnacle Health has provided us to perform these procedures, I think we can provide people in central Pennsylvania the finest possible stent graft repairs in the country.
Please join us to learn more about stent graft repair of thoraco-abdominal aneurysms from Pinnacle Health's Heart and Vascular Institute on May 18th, 2009 at 7 p.m. Eastern Time. Pinnacle Health, proven heart care.
There are many different ways progression of the disease can be slow. However, people with these heart problems must monitor their heart rate and limit athletic activities. They are sometimes even put on a cardio program to keep their heart healthy.